wabarakatuh. My name is Jalaluddin bin Nasruddin, and today my group have choose volleyball. And what injury that have in a volleyball? First, shoulder dislocation. Second, muscle strain of back. Third is wrist sprain. Fourth, sprained ankle. Five, ACL or anterior cruciate ligament tear. And lastly is a sprained finger. Okay, thank you. Hey, are you okay? Sit down, sit down. Are you okay?
My shoulder hurt.
Oh, okay, let me get my bandage.
Fast.
Are you okay? Shoulder hurt, the shoulder. I think you have dislocated the shoulder. Let me fit your ear. Okay. Okay, I will touch the eyes. This eyes will help you to reduce swelling. Okay. Okay.
Okay, Assalamualaikum warahmatullahi wabarakatuh. To all my classmates and lecturer, my name is Muhammad Hafiz Shah bin Harun Shah, and I'm from SR 134B. And today I'm going to present about the muscle strains of the back in volleyball players. This is one of the most common injuries in volleyball players because the amount of movement we have to do, for example, like jumping, spiking the ball, and landing while when you are jumping. So in volleyball, the cause of the lower back pain is related to asymmetry endurance muscle that stabilize the lower back. So the core muscles provide stability to the lower back and spine with all the movements. So if there is an imbalance presence in the core muscles, then player may spike or serve the ball, increase turning and bending their spine, like overly bending, like overly turning their spine. So this extra movement from less stability in the spine cause increased pressure in the joints of the lower back spine or the lower spine. So a violent off jerking motion or an overextension of the back, like when you try to spike the ball, sometimes players accidentally move their whole upper body backwards and sometimes can land like that. So because of that, of the back muscle usually causes back muscle strains too, because one or more back muscles, tendon or ligaments tend to tear because of the overextension of the movement. So this repetitive pressure over time can lead to lower back pain in volleyball players. Other muscles that work in the hips and legs also affects the stability of the spine. For example, the gluteal muscles, which is your buttocks, from the back of your pelvis, the hip bones, down to the outside of your thighs. So your gluteal muscle work to prevent your trunk and hips from bending too far forward during landing. So if you were to land at a weird way, land awkwardly, so it can happen your lower back pain even further. So this poor landing posture results in decreased stability of the spine and increase the risk of lower back pain in volleyball players. So as of a result, this is one of the example when you try to spike a ball and your back is hurting.
Ow! My back. Okay tak? Ya kan? Tengok belakang. Dulu. Kau lihat. Nanti X. Get the eyes. To your right or to your left? Right. Right.
I think we should rest. We don't have to play anymore because this is quite a gruesome injury. I don't want it to get more severe than this. Okay, I hope that example video helped to imagine the situation on how the pain can occur. So in order for you to treat the lower back pain is to have ice near you. So you can treat the pain by using ice before 24 hours as an early treatment. But you will be needing either a piece of cloth or to add like a padding for your lower back so that the ice doesn't touch the skin. You can even use other than piece of clothing, something like a ziplock bag, but the ziplock bag is too thin too thin to act as a padding, so you'll be needing a couple of ziplock bags. So I think it's better for you to use a piece of clothing because it's quite thick enough so that the sheer coldness of the ice doesn't damage the skin cells. So after you give or receive an early treatment, immediately rest the day that happened. You will be not continuing any other exercises that are going to use your lower back. I think every exercise uses a lot of lower back and back muscles, so I think it's important for you to just rest for the rest of the day and immediately consult to a doctor. After you rest, you need to consult the doctor the next day to inspect further damages to your lower back in case it is gone a bit more serious than we thought before. So that's it for the back strain muscle.
Assalamualaikum warahmatullahi wabarakatuh. First of all, I will introduce myself. My name is Siti Umairah binti Zulkifli. So today I will explain and show you the treatment for wrist sprain. A wrist sprain occurs when the strong ligament that support the wrist stretch beyond their into limits or fear. This occurs when the wrist is bent or breathed or twists forcefully, such as caused by a fall into an outstretched hand. So how to treat a wrist sprain? The first step for treat the wrist sprain is first one is rest a sprain wrist to help reduce blood flow to reach. The second one is put your ice into your wrist to reduce pain and swelling. The third one is compress the wrist with a bandage. So right now I will show you the demonstration to treat the wrist sprain. Is it hurt?
Yes, hurt.
First and foremost, raise the sprained wrist above the patient's heart to help reduce blood flow to the region. You do not want to place the ice directly on the skin, as this may cause a cold injury or burn injury from the ice. Place cloth between the skin and ice to insulate it. Apply ice for 10 to 15 minute interval. The application of some type of ice will be in order to help reduce pain and swelling, as ice will constrict blood vessels. And then wrap the area with some type of pressure or bandage to help support that sprains, making sure not to wrap too tight to reduce circulation.
My name is Nurul Nabila binti Muhammad from SR 1134. So today I will talk about sprained ankle. A sprained ankle is caused by rolling, twisting or turning your ankle in an unusual manner. The tight band of tissue, which is ligament that keep your ankle bones together, might be stretched or torn as a result of this. Ligaments function in the stabilization of joint and the prevention of excessive movement. When ligaments are stretched beyond their normal range of motion, it results in a sprained ankle. The ligaments on the outside of the ankle are most commonly injured in sprained ankles. The condition of a sprained ankle determines the course of treatment. Although self-care and over-the-counter pain reliever may suffice, a medical examination may be required to assess how seriously you have sprained your ankle and the recommended treatment. Here is the sign and symptom of a sprained ankle, very dependent on the severity of the injury. They may include pain, especially when you bear weight on the affected foot. Second is tenderness when you touch the ankle, swelling, bruising, restricted range of motion, instability in the ankle, and popping sensation or sound at the time of injury. A factor that increases the risk of a sprained ankle are sports participation, uneven surfaces, prior ankle injury, poor physical condition, and improper shoes. Here is the treatment for the sprained ankles victim. The first thing they have to do is rest. Avoid activities that cause pain, swelling, or discomfort. Second is ice. Use an ice pack or ice slush bath immediately for 15 to 20 minutes and repeat every 2 to 3 hours while they are awake. Third is compression. To help stop swelling, compress the ankle with an elastic bandage until the swelling stops. The last one is elevation. So I will show you the demonstration on how to do the treatment of the sprained ankle. Based on the demonstration, I can conclude that the mistake that he has done is he wears an improper shoes. So here is some tips that you can use to prevent a sprained ankle or recurring sprain. First thing you have to do is warm up before you do any exercise or play sports. Second is be careful when you're walking, running, or working on an uneven surface. Third is use an ankle support, brace, or tap on a weak or previously injured ankle. Fourth is Wear shoes that fit well and made for your activity. Minimize wearing high-heel shoes. Don't play sports or participate in activities for which you are not conditioned. Maintain good muscle strength and flexibility. Last but not least is practice stability training, including balance exercises. Thank you. So, here is some tips that you can use to help you prevent a sprained ankle or a recurring sprain. The first thing you have to do is warm up before you exercise or play sports. Second is be careful when you're walking, running or working on an uneven surface. Third, use an ankle support brace or tap on a weak or previously injured ankle. Fourth, wear shoes that fit well and are made for your activity. Fifth, minimize wearing high-heeled shoes. Sixth, don't play sport or participate in activities for which you are not conditioned. 7. Maintain good muscle strength and flexibility. Last but not least, practice stability training, including balance exercise. I think that's all from me. Thank you.
To Nabila for the video. Assalamualaikum warahmatullahi wabarakatuh, and good morning to Miss Aisha and all my fellow friends. My name is Jalaluddin bin Nasruddin, and today I will talk about the anterior cruciate ligament tear or ACL tear. First, I will talk what is the anterior cruciate ligament. The knee is a hinge joint held together by 4 ligaments. A ligament is a structure in the knee that holds the bone together and helps to control joint movement or motion. There is a ligament on each side of the knee, the collateral ligaments, and 2 ligaments deep inside the knee. The 2 ligaments inside the knee that cross each other are called the anterior cruciate ligament (ACL) and the posterior cruciate ligament (PCL). Both ligaments attach on one side to the end of the thigh bone or femur, and on the other the top of the shin bone, tibia. During the activity, the ACL controls how far forward the tibia can slide relative to the femur. It essentially acts to prevent too much forward movement, while some degree of motion or sliding is normal and is required for knee function. Too much motion may damage other structures in the knee, which can lead to long-term problems in some patients. Second, how is the ACL injured and what are the symptoms? The ACL can be injured or torn in a number of different ways. The most common mechanism is that of a sudden pivoting or cutting maneuver during sporting activity, which is commonly seen in football, basketball, and soccer. The ligaments can also tear due to work injuries or automobile accidents. At the time of the injury, pop or snap can sometimes be felt or heard. The amount of pain experienced at the time of the injury is somewhat variable but can be quite severe. Typically, the person is unable to continue play or activity and has an impression that a significant injury has occurred. Immediate swelling of the knee develops at the time of injury within the first several hours, but the extent of swelling can be limited if the knee is immediately iced or split. I will talk about how is an ACL injury diagnosed. An ACL tear can be diagnosed by a physician through history and physical examination. On physical examination, the physician can specifically assess the amount of motion present and determine if the ACL is torn. Additionally, evaluation of other structures within the knee is done also, as ACL tear is often found in association with injury to other structures within the knee, such as the cartilage and collateral ligaments. X-rays are taken to evaluate for the presence of any fractures. In many patients, an MRI scan of the knee may be ordered. The scan can clarify the equations of an ACL tear if the history and examination are inconclusive. The scan is also useful for evaluating the cartilage or meniscus tissue in the knee if this information is necessary to make decision regarding the best treatment for a specific patient. Next, what are the different types of ACL injury or tests? ACL injuries are commonly classified in grades of 1, 2, or 3. Grade 1 injuries include ACL that have suffered mild damage. Example is the ACL is mildly stretched but still provides adequate stability to the knee joint. For the grade 2, ACL injuries are rare and describe an ACL that is stretched and partially torn. For the last grade, for the grade 3, ACL tears happen when the ACL is torn completely in half and is no longer providing any stability to the knee joint. Last but not least, what is the treatment for an ACL injury or tear? Treatment options are based on the patient's symptoms or examination, the growth remaining in his or her growth plates, type of injury to the ligaments, and the type of sports and activity goals. There are two ways. First is non-surgical treatment is most appropriate for grade 1 injury. This will include immobilization or bracing, physical therapy, and a gradual progression back to regular activities and sports. Second is surgical treatment. It's recommended for an individual with a grade 3 or complete ACL tear. Surgical options may vary based on the type of ACL injury, whether the patient has open or closed growth plates, and the types. That's only from me. Now, I will pass the next video to Alvi. Thank you. Okay, for today, I will teach you how to play volleyball.
Okay, I understand.
Thank you. Good. Okay.
Okay.
Now, we must to hit the ball like this. Okay. And when the ball comes, please pick your area of your leg like this. Do like this for your stability, and you hit the ball like this. Okay. Okay. 1, 2, 3. You good?
Okay.
You good? You good? Okay. Okay. Now, for the second lesson, I will teach you how to smash the volleyball.
Okay.
For the second lesson, you must do right, and you jump and do like this. Okay. For that goal. Okay. Okay. Run. Okay. First, you must start here. Okay. When I do like this, you must to run and hit the ball to that. Okay. Okay. 1, 2, 3. Okay. Come on. 1, 2, 3. It's okay. Okay. 1, 2, 3. It's okay. Okay. It's okay. We are the amateur. We are not a professional volleyball player. So they have any mistake, a big mistake when we are doing training.
Okay.
Okay. 1, 2, 3. Okay. Come on, Zidane. We are running out of time. One, two, three. 1, 2, 3.
Oh, very far.
Wow. Wow, it's too far. Come on, come on, come on. Pass to me. Okay, come on. Alright. Hey, Viren. Why? Okay. Now, I don't know what are you hurt now. And yeah, the surface is too smoothly, slightly after the rain. And okay, please increase your leg. Okay, I will open his shoes. Where are you here? Here?
Yes.
Okay, Aisha. Where Aisha? Okay, Aisha. Please take the first aid in the house and also the bandage.
Okay, okay, okay.
Okay. Okay, this is a first aid and this is a bandage. And before we do the diagnose, it is easier for us when the athletes have injury. These two things is a very important. Okay, Aisha, I forgot. Can you call EMS, emergency medical service, right now?
Yes.
Okay, thank you. Okay, Zilin, when you sleep on the ground after you smash the volleyball, are you hear something or any else?
Yes.
What are you hear?
I'm here. Pop.
You hear pop?
Yes.
Okay. For this injury, I think for the first diagnosis, Izudin have had ACL tear, anterior cruciate ligament tear. Okay, now I don't know how much grade Izudin had it, because the ACL injury they have 3 grades: grade 1, grade 2, and grade 3. Grade 3 is a very complete tear at the knee. Okay, now Izudin, can you move? Okay,
Alright.
can you move your leg slowly?
Alright.
Okay.
Ah.
Huh? Are you hurt? Are you hurt?
Yes.
Okay. Okay. Slow down. Slow down. Okay. Okay. From my first diagnosis, Izudin had first grade for his ACL. And what what are we doing now? For the first grade, we do not have a surgical. Okay. Why? Because Izudin has only the first grade for the ACL, and Izudin, I think you should. Okay. A few minutes later, ambulance will come. And what are you doing? Okay, you have not have a surgical. You just only go to the treatment. You just go to the physiotherapy. Okay, to massage your leg. And if you want to do some exercise when you are grade 1 for the ACL, you just do the smooth exercise. Okay, for maintain your stamina, maintain your sports. Okay. Okay, that's only from me. And oh, before I'm forgetting, the ACL is located at knee. Okay, and it's a very common injury at any sports. ACL uh, can be had at the activity exercise, or ACL also can be had at when you have a accident, car accident, or any else. Okay, I hope you can be healthy after this.
Okay, thank you.
Okay, thank you.
Okay, hello again. Right now, I'm going to present about the sprain finger in volleyball players. Okay, sprain finger are caused by physical impact to the finger. Okay, in most cases, sprains are caused by a blow to the end of the finger, the one where the ball came fast and hit the finger directly on the nails. So it's not like the ball came like this. So it's more like either the ball came like directly straight from the finger and hit you like that, or it came like this, where there's a force that ends here. So that's where the pain comes from. So this cause which reverberates up to the joint and cause it to become hyperextended. So other than that, a fall can cause this finger sprain too. Because of this, it can stretches and tear the ligaments in the finger. Okay, here's a video to make it like more understandable. Oh, terkena jari lah. Bila? Ini tak terbaik. Sakit. Depan saya. Okay, I hope the video helps to picture of the sprained fingers. Now I'm going to tell you how to make an early treatment. Okay, firstly you'll need the rest method, which is rest, ice, compression and elevation. When you got the pain, you need to rest and not continue the game to avoid further damages to your ligaments and to your finger. So the second is ice. It is the same principle as the lower back pain. You'll be needing to have an ice, to put the ice in a towel or a piece of clothing so that it doesn't make the ice doesn't make a contact to the skin directly. So after you put ice, a couple of minutes, like 20 minutes, you put the ice. You can, after that you'll be doing a compression, which you wrap the finger, the hurt finger. For example, you hurt your index finger, so you'll be needing to wrap it with your healthy finger, which is your middle finger, so that it can have a support, so it can support your sprained finger. So by compression and elevation, it both can help reduce swelling. You've been doing this especially at night when you are resting, while you are sleeping. So this is the best way for you to have an early treatment for sprained finger. After the next morning, you can consult to your doctor to see if it's bad or not. Thank you. That's all.